So this video is long overdue. I've been meaning to post for a while, but I haven't had time. I haven't really talked to anyone on here or had any contact with YouTube at all. Like, I have internet, but um, I'm going back to school. This is my first semester back in 2 years, and I'm still working full time. So I really don't have time for much of anything right now. Like I had a day off last weekend and I have this Saturday off. But like I have no time. I've been meaning to post a video since the middle of August. That would have been my 2 months after surgery. It's almost been 3 months since my chest surgery now. Um, I'm going for a revision, December 28th. There's dog ear on my left side. I'll see if well, this is what it looks like right now. It's kind of hard to see. The lighting in here kind of sucks. But that's my chest. You can't really tell, like, you can kind of see the dog ear, but all that's gonna get like taken off. It's gonna be another 3 to 4 like incision, like 3 to 4 inch incision, like around my back up here to correct it. Doctor released us free revisions for a year, so I figured I might as well get it taken care of while I have the chance and as soon as possible. And really, the only time I could go was in December, right after Christmas, because that's when I'm on my winter break from school. Um, yeah, let's see what's been going on. I have a cold again, the second one in like 2 weeks or 3 weeks. Like it didn't stop. I was sick, and then I kind of got better, and then I got sick again, and yeah. And I really need to do something with my hair. I'm letting my bangs grow out so I can have emo bangs. Like it's still early, but I want them to come down like down here, cover my eye. I'm gonna keep it short up here, but let's see what else is going on. I'm planning on hopefully starting tea soon. I just have to get some money saved up. I just had to hopefully I can find an endocrinologist this month, but like I just had to pay rent for October, so I don't really have money at the moment. But hopefully by the end of the month or next month, I'll be able to start testosterone. I mean, I don't know yet. I'm trying to not go to therapy. I went to therapy for a while. I don't know if I really talked about my views on therapy before, but so here it is. I went to therapy for before I like last summer. I started like last August. I went for about 3 months, and my therapist told me it was gonna be 6 to 8 months before I could even get a letter for T, and at least 18 months for a surgery letter. But um, I didn't feel like it was beneficial for me to be in therapy. Um, I didn't feel like I know how I feel. Like I don't need someone to tell me what I should do or what is acceptable or what, I don't need somebody's permission to have the surgery that I need or to get what I need to make me feel like myself. I'm not going to change my mind. I know how I feel. Like, just because I haven't been, I've been out like completely at work and family for almost a year now. Just because maybe I haven't been out as long as some people, it doesn't, make me any less. I mean, less trans or anything like that. I've known for a long time. Just because I haven't been out that long doesn't make a difference. I mean, and you don't need to go to therapy for it. I understand there's probably some people that would benefit from it if there's other circumstances or other conditions or issues that you would want to talk to somebody. I can understand that. I mean, I did go to therapy, and it's not for me. I don't think it's for everyone. I don't think it's something that's necessary. I mean, it could be for some people, but I don't think everyone has to follow certain steps to get to what they want. Um, with that being said, like I went to therapy and I sat on the idea for a while. I after I stopped going, I figured, okay, maybe I just don't like my therapist. Then I felt really hopeless. I didn't feel like there was any way around getting what I need to get done. I didn't feel like there was any way around it. I thought I had to go through these steps. I thought I had to do one after another, and each in a certain order. And I'm just like, well, crap, because number one goal was to get my surgery first. I was undecided on this testosterone up until recently, like over the past summer. Maybe like I've been debating it for a while and thinking about it and researching it and everything, and I finally came to the conclusion that I do want it, mostly because of my voice. Otherwise, I generally pass, but when I'm on the phone, my voice doesn't pass. But anyway, so with that, I figured, okay, well, I have to do that first before I can even get surgery. So I felt stuck, but and then finally I decided to do some research. Just one time over the winter, last winter, I was like, okay, well, I don't have anything to do right now, so I want to research this. I want to see if I can find a surgeon or find somebody that will do surgery, my chest surgery, without having a letter. So all I did was I looked online for plastic surgeons that do transgender surgeries. I sent out a bunch of emails. I probably emailed like 20 people just to ask, to inquire about their policies and they what they require. I got most of the people actually responded back to me. A good majority of them said that they need a letter from a therapist. But there were several that did not. Dr. Brownstein in California, he said he only required a letter if I was trying to use a certain insurance plan that he takes or whatever. Um, there was another one in, I believe, San Antonio, Texas. Gary Lawton, I think was his name. Who doesn't require a letter. There was also someone in Ontario, Canada that doesn't require a letter, and then Dr. Sherman Leis in Philadelphia. I mean, there may be more, but these are the ones that responded to me that told me they did not require a letter. And so I went to Dr. Leis. And he actually, like, he wrote me a letter after surgery saying that I've had gender reconstructive surgery and that I'm living full time as male as required by the World Transgender Association or whatever, the guidelines. And he wrote that for me so I can get everything changed because currently my name isn't legally changed yet. But now my goal is to find an endocrinologist that does not require a letter from a therapist. And I mean, I could find a surgeon, so I don't see why I can't find a endocrinologist that would do it based off informed consent or not require that. But that's what I'm looking at right now, but currently there's been like I haven't had any money to do so. But hopefully soon. And I think that's about all I wanted to talk about. I wasn't really planning that, but I did want to talk about my views on therapy. Like I said, I don't think it's necessary for every single person that thinks they're trans to do it. But if you feel you need to talk to somebody, I'm not saying don't go. I'm saying by all means go to therapy if you feel that it's right for you. I mean, I went for a time and I didn't feel it was right for me. But yeah, everyone's different, so if you feel you need therapy, by all means, go ahead and go. Like it can be helpful to some people. It just wasn't my thing. But I think that's about it. Here's my chest one more time. So let's see. That's kind of the lighting kind of sucks. But I mean, I'm really really pleased with results. Like I couldn't be happier. Like it's amazing. I feel so much more me now. But okay, I think that's about it for today. Hopefully, I will post videos more often, but that's about it for today. So have a great night, and I'll talk to you guys later.